Welcome back to the County Seat. For those of you who are just tuning in, the County Seat is a regular weekly television program about local issues and things that affect the counties in the state of Utah. Now, if you miss our Sunday broadcasts, we're also available on all of the major cable operators in the state, and they air this broadcast several times during the week. So check your local cable operator or our website, thecountyseat.tv, and you can find when the local broadcasts are in your area. Well, right now it's time for us to move on to our second story. It's about the state of health in Utah. It's actually more about the state of local health in Utah and the local health departments. Currently, there are several federal mandates and state mandates that are unfunded that county health departments are obliged to fulfill. It's putting some financial pressure on the local health departments where services are actually rendered. Here with the story is our own Susan Wood.
Everyone depends on the health department, whether it's getting your kids immunized or just making sure your favorite restaurant is safe. Some people say you can't put a price on good health, but there is a price, and it's high.
Local health departments are charged with the responsibility of preventing disease, promoting health, and protecting the health of the population that they serve.
That is not an easy task. There are 12 local health departments in Utah, some covering a 5-county area, providing many programs to keep the public healthy. They inspect restaurants and swimming pools, educate and provide for needy mothers and babies, assure that drinking water is safe, give shots to avoid the spread of dangerous disease, and the list goes on. These programs require adequate funding, but in Utah, there is not a lot of money to go around.
We traditionally in Utah have funded public health at about the lowest rate in the nation. And so, we're forced to do a lot with very little.
I think the bottom line that people need to understand is we just don't have enough supporting our efforts, whether it's the local health officers and their departments or whether it's the state officials and their department. We just need more resources to help do what we've been asked to do.
The state health department's role is different than that of local health departments, and one of its roles is getting grants to cover the costs of many healthcare programs. Then the state will often enter into contracts with local health departments to carry out the work.
We are actively trying to do things differently with the local health officers so that we can solve both goals with very limited resources.
But here's the problem. While the state of Utah is already underfunded when it comes to health, the state can't pay the counties what it costs to run some of these programs.
We've left local county governmental entities to fend for themselves and not adequately ensured that the resources are delivered for them to accomplish what they need to accomplish. So in our state, we have a state health department that has more people at the state level than all of the local health departments combined.
I don't think we need more people sitting in desks in an administrative capacity, which is mostly that's the role, in my opinion, of the state health department. But what we really need is people who go out and do the work. I may need an extra nurse or two who can actually give shots. I may need an extra secretary who can actually go ahead and take information so I know exactly what I need to know about that particular client that comes through the door at that time. That's much more important than any bureaucracy. Now obviously I have a bias because of where I work.
I do understand that they see it from their side, and they're seeing individuals come in every day and they're saying we have programs that we have to do and we just don't have enough money for it. And that's a big consideration across all of public health, where there's just not enough money to support what needs to be done, whether it's at the state level or the local level.
Dr. Patton is aware of the perception among local health departments. He says state health workers are in touch with legislators and the governor's office practically every day, trying to secure funding for the health needs of all Utahns. But until there is a crisis, like H1N1 flu virus or contaminated public swimming pools, healthcare just doesn't seem to be a top concern.
It's a matter of priorities, and in this state the priorities have been pretty well established, and public health hasn't been ranked in the upper, probably 3 even for a while. That's something we would like to see changed.
I mean, overall the pie's not big enough. We haven't prioritized that in the state. But the money that is there is really not going to the places that it needs to be. People that offer the services, local health departments, end up getting very, very little of that money.
And sometimes we either need to pull our appetites back in terms of what we need to do, or we need to recognize that there's got to be a way to fund those things.
Some counties, not health departments, have opted to deal with the problem in another way, and it's not a very popular way, by raising taxes. But that way, local dollars stay in the area to help with local health issues. For the county seat, I'm Susan Wood.
Thank you, Susan, for that report. We'll be taking an in-depth look and have a discussion about the impacts of the relationship between state, county, and regional health departments and see it from their perspective when we come back in just a minute. We'll be joined by Lloyd Berenson from Cache Valley and the health department in the northern part of the state.